So today I will do a thorax and lung assessment, and I'm gonna scan my room here. Oops. Here. Oops. Here's the wall, and that's it. All right. So for the next part, I will ask a few questions to Mr. Montagna related to the lungs and thorax assessment. Do you smoke, Mr. Montagna?
Yes.
Oh, for how long have you been smoking?
11 years.
Okay. And did you experience any shortness of breath or trouble breathing lately?
No.
No? Okay. So we will continue with the exam. For the next part of the exam, I want you to take your shirt. Okay. So um, I am now inspecting his lungs anteriorly, posteriorly, and laterally for any lesions, any type of abnormalities, or maybe surgical incisions or scars. But looks like it's okay. And then I'm also while inspecting, I was also checking for respirations. Um, uh, uh, as I can see, it's about 16 to 18. Respiration is about 16 to 18. It's regular, it's effortless, automatic, and his breathing pattern is also effortless and regular. It's automatic, and I'm also checking the skin color. I don't see any cyanosis or pallor. And then his position is sitting in a comfortable manner, resting hands on the sides at rest, and his chest expand the symmetry of his chest expansion, or there is a symmetry and uniformity during chest expansion. And I don't see any use of accessory muscles. I also don't see any retraction or bulging appearances of interspaces. And then the anterior posterior the transverse ratio is 1:2, so that's normal. And now I will palpate his chest wall. I'm gonna touch your chest wall. Okay, I'm looking for any lumps, tenderness, lumps. Do you feel pain when I touch
No.
this? No. And laterally, also on the other side, any tenderness when I touch the
No.
hair? Okay. So can you please turn your back? I need to see your the chest symmetry during chest expansion, if there is any lagging. So putting my thumbs on the T9 or T6, a T9 or T10 level here. Can you please take a deep breath? Okay, I didn't see any lagging. So can you please turn your in front, face front. And now I will do auscultation using the diaphragm of my stethoscope, and I will also instruct my patient to play deep through your mouth, deeper than usual when I auscultate.
All right.
Thank you. So I will start with the anterior lungs. There are 5 lobes, but I will start with the anterior trachea. I mean anteriorly on the trachea. Okay, take a deep breath. So there are 5 lobes here to be checked and auscultated. And the 5th one. Okay, and on the left side, I will check 2 lobes here. And the other side, on the right side, there are three lobes here to be checked. One right upper lobe, middle lobe, and the right lower lobe laterally. Okay, so now can you please turn your back? I will check your lungs, auscultate your lungs posteriorly. Perfect. So this is the spinous process, and this is 7 below that's where I will start. That's the T1. That's where I will start my auscultation here. Take a deep breath. Okay, so there are 9 lobes posteriorly. So this is the end of the scapula. So I should be can you sit straight? Yeah, here, the scapula here. So here below the scapula is my 7th rib. Here, yeah, 7th. And then my 8th here. And 9th. So overall, I heard bronchovesicular sounds on the major bronchi pathways here, and then I should expect also vesicular sounds here on all over the periphery of the lungs, and vesicular sounds on the posterior lower back. And yeah, we're done now. Thank you. Can you please turn in front? And then so I to describe the sounds that I heard on the over the trachea and larynx, I heard very soft low pitch sound, no, a very high pitch sounds, which is the bronchial sounds, and then on the major bronchi pathways, I heard bronchovesicular sounds, which is moderate, and then or moderate pitch, and then all over the periphery of his lungs and the lower part of his posterior lungs are the vesicular sounds, which are very low in pitch. So that ends my thorax and lung assessment. Thank you.